So thanks for coming in. I'm Rose Hoban. I'm the editor and founder of North Carolina Health News. And I'm going to talk about, do you want me to go first? Or? So I'll go first and then I'll let Jiquanda tell her story. Why don't you introduce yourself first though?
I'm Jiquanda Johnson. I'm a publisher and editor of flintbeat.com in Flint, Michigan. It's a hyper-local news publication focused on everything between A and Z and Flint.
And North Carolina Health News is just what it is, which is focused on everything A to Z on healthcare in North Carolina. So we were just talking before about what drove us to start our sites. When I started North Carolina Health News, I was one of North Carolina's a state of 10.2 million people, and when I started the site, I was one of 3 FTEs worth of health reporter in the state, and that was me, somebody at the Charlotte Observer, and then 2 half-time people around the state. So there was clearly a need, and that's why I started North Carolina Health News, which is completely crazy that all the health reporters have been laid off, because we're in this time where we've got all of this stuff happening. And I'm really sorry about the quality of this, because in orange that says covering health reform, but because of red, it is proclaimed. So I don't know why it's all red. So anyway, healthcare in North Carolina is, I've done a back of the envelope calculation, somewhere between 26 and 27% of the state budget. Our Medicaid budget last year was 14-point-something billion, and at this point now, me and the folks who work for me at North Carolina Health News are the only people covering healthcare consistently in the state, and everyone else are GA people. So, and I like to think of myself as a resource for all those GA people who need help. So anyway, so I've been covering health reform pretty aggressively. So the title of this is, wow, this really sucks. The title of this is National Resources, Kaiser Health News. So folks here, do you know about Kaiser Health News? Okay, so you can use Kaiser Health News stories on your own. You can put them on your sites. And I localize them with my own photos, sidebars, and boxes. So these are 2 stories, one of just done recently. Medicaid covers all that. It's the backdrop of America's ailing health system on the right there. So that's Phil Galewitz's story. I used Phil's story. I used one of our photos that we used from a different story about medically fragile children. And then I did a pull-out box on some Medicaid stats inside the story. So when Phil is going through and talking about national trends, I'll just do a little box within the story that will have some North Carolina numbers. So it's a really easy way to localize the story. These always get plenty of traffic. And what amazes me is that the publications in the state, like McClatchy is the big chain in the state, so the News and Observer and the Charlotte Observer are both the big chains in North Carolina. And I think I figured out the problem here. Oh, there we go. There we go. I will just hold this very carefully. So McClatchy, basically, they don't use these Kaiser Health News stories. I don't know why, because they're really good. They're deeply researched, and they don't get used. So we use them, and it's not like, other people are seeing this over and over, right? They're getting it from us. And other national resources. So Stateline, people know about Stateline? Okay, Stateline is a news service that was created by the Pew Trusts. They're policy focused, and they have policy areas that are like education, environment, urban planning, and healthcare. You can search by state, and you can search by topic area on Stateline. And again, they're really good stories. Most of the reporters who work there have worked at places like the Washington Post and the New York Times, and they put out one big feature story a day, and then they do roundups. But so when it comes to healthcare, you'll find stuff, and it will explain trends, right? So what Trump promises to speed Medicaid waivers for more beds. So that way you can have Medicaid waiver story, and then if you've got a Medicaid waiver going that's, in application in your state, you can put a box, you can put a sidebar, and that way you're only calling one person, but you've got to localize the story. The conversation is a website that's, again, open access. People can use it, and there's stories written by academics, but they're actually pretty well written. This is one of Dylan Smith's favorite resources. So I haven't used it yet, but I came and Dylan was sort of like beating me over the head, like, why are you using conversation? So I stuck it in here. And then finally, if there are now I know that I'm a not-for-profit in North Carolina, so I've reached out to all the other not-for-profits around the state. So this Carolina Public Press, they cover the 18 North Carolina's got 100 little counties, and Carolina Public Press covers the 18 westernmost counties. So I had coffee with Angie, who's the editor at Carolina Public Press, earlier this week, and I said to her, and she was like, I really hate healthcare. I never want to do healthcare coverage. It's too complicated. I just don't know about it. I was like, so Angie, so here's what I'd like you to do. Find a freelancer who you think is capable of writing healthcare stuff, and you write stuff about your part of the state, send it to me. I will edit it for, healthcare stuff, and for, because I've been reporting on healthcare for 13 years in North Carolina, so I know the whole history of Medicaid and whatnot. I can point your reporter to places where he or she needs to go, and I can edit it, and that way it'll be that much better, and we co-publish. And she was like, yeah, I'm like, yes, and we've been trying to sort of make this happen for a long time, and we just needed to sit down for coffee and talk about it. So that's another place where you can get resources. So that really should be under local resources. So this is a really crazy, complicated time. How do you get up to speed on what the hell is happening health reform-wise? One of the best places that I love, it's open access, is, it's free, is the Health Affairs blog. And Health Affairs is the journal of health policy, right? Like JAMA, the Journal of the American Medical Association, they're looking at stuff like, clinical trials or what drug works better than another. But Health Affairs looks at what policies work better than others. There's a guy who works for Health Affairs called Tim Jost. When Trump made that announcement about not funding the CSRs, the payments to insurance companies to cover people, I got that tweet notification as I was going to bed on Thursday night, and I turned to my husband and said, "Motherfucker!" And then I went to sleep, and then woke up the next morning, and by the next morning, Tim Jost had written 1,500 words explaining what had happened, and I tweeted out, "Does Tim Jost sleep?" And with a thing to that, and Health Affairs retweeted it. But Tim is a lawyer, and he's a healthcare lawyer, and he works and he teaches at Washington and Lee University, and he has been following the Affordable Care Act since the day it was passed. So probably no one in the country knows more. And some of his blog posts are a little bit dense, but for the most part, they're just really super thorough. Other places to look is the Brookings Institution, which is a nonpartisan think tank in DC, and they have a healthcare policy blog. And so that's the URL right there. Again, a little bit dense, but they, and it won't always have what you want, but a lot of times it's a jumping off point for stories, or they'll do analyses of what happened. And then if you want something that's a little more, that they move pretty quick on it, Axios, if you're not signed up, if you want to follow healthcare, Axios has a healthcare email newsletter, and they're really quick, and they just basically do a lot of aggregation, and then sometimes they'll have commentaries written. And for example, Larry Altman, who's the head of the Kaiser Family Foundation, which I'll talk about more, he does a lot of his stuff on Axios now. Vox does great explainers about health policy stuff, as does Stat. The only problem with Stat is that half of the website's behind a paywall. I ponied up the $150 to pay for Stat because they do such good reporting, and it helps me keep up to date. But the stuff that's in front of their paywall, maybe a third of their content's in front of the paywall, and then the rest is behind the paywall. So they'll kind of keep up with what's happening with health reform too.
Excuse me, is that 150 per year or 150?
Yeah, it's 150 per year. Yeah, it's not, it's like I subscribe to the New York Times, Washington Post, local papers, and then I just swallowed hard and subscribe to Stat just because it really is, they launched like 2 years ago, they had money behind them, they hired all kinds of fancy pants reporters, and they're crushing it. So I really felt like I just needed to read what they were writing. And then some good places that are good national resources but tend to move a little slower are the Commonwealth Fund. Commonwealth just did, for example, they did a great study on underinsurance, right? Folks who have insurance but they can't get their stuff paid for. So it has state breakdown numbers. So you can go there and really quickly localize that study. Robert Wood Johnson Foundation, they move a little slower. So they'll be a week later. So they might do sort of implications down the road. And then finally, you should go and look and see what foundations in your state are funding healthcare stuff, because they'll have an interest in health reform, like in Affordable Care Act, and they'll be probably collecting some data. I know in North Carolina there's one, and frankly they fund us to have a rural health reporter, and so that's the big healthcare funding in the state. Medicaid by the numbers. I do this story every year. It gets buku traffic. So what I do is, you can take a look at it if you want, but all the stories in this, all the graphs in this story, I'll pull it up, all came from a presentation down at the legislature. So I didn't have to do anything other than do the screen grabs of them. And I just got this number and I just blew it up and made a big font, in not Silk, what's that, Canva. If you have a Canva account, you can do easy graphics. And so I just did this big number, with the big pretty red numbers from Canva, right? And then, and that's all, this is all according to Steve Owen. He just basically sat and did a presentation for our legislature on Medicaid. And so there's probably a fiscal research or fiscal division or something like that, or a legislative analyst in your state legislature, and you can go to them and they'll probably have a presentation like this that's public. So all these, the pie charts, this funding sources thing, this was all from Steve's presentation. And this big pie chart about where the money goes, that was all, so it was super easy. This was a great one. It's how, what groups in Medicaid, what the per person spend is. So there's a breast and cervical cancer program for women who are low income. So there's not a lot of women, there's only a couple hundred women, but their spend is per person is $3,500 per year. Meanwhile, so this was a story I ended up doing, family planning, the per person spend was less than $7 a year, but there's more than 200,000 beneficiaries in the program. And so I wrote something about how the Medicaid family planning program was such a good bargain for the state. So really easy stuff. There we go. That's how we get people to sign up for our newsletter. Okay, so Kaiser Family Foundation, if you've never taken the time, go explore their website, kff.org. They have lots of Medicaid numbers, and I'll just take you through. It's a little hard. They reconfigured the website a couple of years ago, and now it sucks. So first off, they have all this stuff that's really current, right? How is this cost-sharing reduction payment, that thing that Trump announced 2 weeks ago? How is it going to affect the marketplace premiums, right? They've been doing the tracking polls on what people think of the Affordable Care Act. So they've been polling people every week or month since the bill passed in 2009. So they have trend data, and you can find it on their website. This 50-state survey, this was really interesting. And then if you look over here, of course, in healthcare reform, one of the big issues is Medicaid, right? I don't know if you were in states that expanded Medicaid. We did not. So this will allow you to compare state to state. Go to this graphics and interactive spot here, and when you click, then you can start looking at health reform, healthcare costs. You can put all kinds of things in here, and it will spit out for example, state by state, you can refine your results. You can compare, you can compare the number of uninsured. Now, their data sometimes is a couple years old, which is a little bit of a bummer. And you can generate graphs for yourself, like how you compare to the state next to you. So it's really useful data on KaiserFamilyFoundation.org. It's worth just searching around on this website. Take like a half hour one night as you're watching, Walking Dead or something, and just kind of click around and see what you find. Let me see. They also, anything that they produce, they have infographics, they have state-by-state infographics, they have PowerPoint slides, all of it is open source. So like, here's the Medicaid, they did this whole Medicaid in North Carolina. They have done one for every state. So there's, these nice little infographic things that, again, you blow it up on your screen, you do the screen grab, and you've got it for your website, right? And you just credit them. And they've done all of these infographics. Medicaid's role in covering veterans, and trauma care, and nursing home care. It's all there. It is a treasure trove for local reporters. Kaiser Family Foundation, KFF.org. Super easy. To cover health reform specifically, I don't know what states folks are from, but experts to know national, and I'm giving you their phone numbers, and please don't tell them that I gave you their phone numbers. The National Association of State Medicaid Directors, Matt Salo is ridiculously accessible. Like, ridiculously accessible. So he'll answer the phone. You get this guy. Like, he's the head of the national organization, and like, he'll be the guy who answers your question. He's very, he's very DC. He'll be very circumspect, but you can always get a quote from him, and it makes you look really like, oh my God, you've got someone from the National Association of State Medicaid Directors. The National Rural Health Association. So if you're covering anything rural, these people do just fabulous research, and they are such incredible advocates for their people. In North Carolina, we have a rural health research program that's out of UNC Chapel Hill. And they're the ones that you may have seen stories about how many rural hospitals have closed and how there's been 18 closures in states that did not expand Medicaid and only one closure in states that did. That was all done out of this shop that's at UNC. And then for you, the places to look for local experts are your school of government. Is there a school of government at like your state land grant university? Like, you would be Michigan State or...
I was typing down the phone number for the national...
Oh, sorry.
I'm not going to type as quickly as I should.
That's okay. I'll also make these available. Okay, you got it?
Yes, sorry.
So is there a school of government? Is there a school of public health? At the School of Public Health, ask for health policy and management faculty, or you ask for their press officer, and they've usually got like a list of levels of expertise, and you can call these folks. And they love being quoted, right? Because they're all tenured, and so they need to kind of show that they're, engaged in the conversation out there. So, and then you'll find somebody who will always answer the phone for you. Health economists are great people too, because they're crunching the numbers on the economic effects of what's happening in health reform. One of the things I've found that's really interesting, especially because the political environment in North Carolina is so toxic, is that the people at UNC, they've become much more cautious, whereas the guys at Duke are really like, they'll say anything. They will say anything, because they're not dependent on the state legislature for their salaries, right? If you have not gone and sat down and had coffee with the head of your local community health center, you should. There are so many stories that come out of community health centers. They're called FQHCs, or Federally Qualified Health Centers. If you put into Google FQHC and your state name, you'll get up like usually a state association of FQHCs or a list of FQHCs. They do amazing work, and health reform is applying directly to them because they serve a lot of Medicaid-eligible children and pregnant women. They serve all the immigrants, and folks who are documented and undocumented, and they take care of a lot of the people who are uninsured. So they're seeing really the effects of health reform, both positive or negative, in their states. Independent living centers. Some states have these, some states don't, but you should definitely talk to the folks who work with people with disabilities. And I'll say that, like, if Congress fails to repeal Obamacare, right? It'll be because people with disabilities went to DC and allowed themselves to be dragged out of their wheelchairs on film, and it ended up on the local news, right? Those people have put their bodies on the line. So they are all, so many of them dependent on Medicaid because a lot of them can't work because they have a disability that keeps them from working. Senior centers, you should check out senior centers. Federally, every area is supposed to have an area agency on aging, so stick in your county name and put an area agency on aging, because that dual eligibles, those are people who are low-income seniors who get Medicare, which is for people over 65, and then who also are too poor, or they're very low income, so they also qualify for Medicaid. So the senior centers in your area and the area agencies in your area will know them. And then you go to the primary care provider associations, like your state Academy of Family Physicians, nurse practitioner nursing associations, OBGYNs, and pediatricians, because they're the primary care providers and they're the ones who really benefited from the Affordable Care Act. So those are my resources for covering health reform. Why don't we let Jiquanda, because we've got a short time, we'll let her talk and then take questions near the end.
Okay, I launched flintbeat.com in March of this year. Prior to that, I worked at NBC 25 and also for MLive Media Group, the Flint Journal. I launched it because I felt like the community was being underserved in the news. Right now, it's pretty much Flint water crisis, sports, and crime. So at the community's call, I stepped out there and I have flintbeat.com. I started covering water issues in 2015. I was at NBC, and that's when we started to have boil advisory alerts throughout the city in these different pockets because the water wasn't being treated properly. But it wasn't until 2016 that it was reported that the children in Flint had elevated blood lead levels since we had switched from using Detroit as a water source to the Flint River. Then in 2016, early 2016, all hell broke loose. I guess national news outlets caught wind of what was going on in Flint. We had everybody stepping on our toes, covering the Flint water crisis. When I was in the regular newsroom, the traditional newsroom, and not an independent individual, it's a little easier because the name carry weight if I was sending questions to the state or the feds regarding the water crisis. They responded much faster than they do with me as an independent. Some of them, they know my name, and if I send an email, they respond. They know I'll write it anyway. And so, as an independent, I had to find other ways to cover the news because they weren't responding fast enough. So I bypassed a lot of times court hearings, regular meetings that are being put together, developed by state officials and city officials. And I do things like go to a lot of community meetings. I troll social media like crazy. Because of that, I find out things of blocks that have maybe bacterial issues that other news outlets don't. I've written stories about people with Legionnaires. In Flint, we had 12 in Genesee County, we had 12 confirmed Legionnaires deaths that have been linked back to the water. Community meetings are a must for me in this. And I also learned that I'm one person, so I have to engage them where they are. A lot of times I don't have time to write a story. I have a day job also. So you might find me on Facebook saying, hey, this is what's going on, Flint Beat just got wind of this. I'll keep you up to date. I might develop something later. I might do a Facebook Live, grab a video of something that's going on at a community meeting, put it out there instead of running back to write a story or sitting there to write a story to post on my site. I don't rely on numbers at this point. I'm more of getting the information to the community. I aggregate a lot too, and I try to keep watch not only locally but national pieces that come up as it pertains to the Flint water crisis. I also learned to develop relationships with reporters that are boots on the ground in the city. Because of the crisis, we had a lot of independent journalists. Right now I'm working with a reporter and we're sifting through death certificates because we have 12 confirmed cases of Legionnaires, but we had an influx of pneumonia cases in the city of Flint, on the north end, in the predominantly Black communities where people are poor. A independent noticed this probably almost a year ago, and going through one death certificate after another, after another, after another with him. It is an ongoing crisis, and I found in being here that people don't understand exactly what is still happening in Flint. Because of the community meetings, I know that charter schools and parochial schools are not getting bottled water. That's what I've been trying to work on since I've been here, so I'm in and out. That's something that the state has not announced, but going to a neighborhood meeting, we found out this is going on. So I just learned that the relationships outside of government officials are, for me, paramount. Like, I couldn't write anything worth anything to my community because they're tired of getting this bill from the state. They're tired of just hearing what the state officials have to say and the city officials have to say, and more of what's going on in the community and how they're really being impacted. So I advise people to have like a willingness to listen. Sometimes I don't report at all, I just sit and listen. I ended up working on a piece with, we had a number of Legionnaires, people who survived Legionnaires. You know, something I pitched. And I got it from an independent journalist. I was still at MLive when I got it, and he stumbled across it, and we had a relationship, and he told me, hey, it's this group of people that survived Legionnaires. I have this list. Some of them didn't even know they had it. And so I sat and I listened a lot before I even tried to report, because it is a crisis. Some people, like I said, they didn't know. So I'm calling people who didn't even know they had Legionnaires, or people who are embarrassed about the crisis themselves. I'm getting these phone calls, I'm getting these emails from people who they just want somebody to listen to their story about what's going on with them. Then I learned no story is small. One point someone called me and they said, hey, somebody's supposed to be coming to my house about my water. Okay, I show up. It's the U.S. Surgeon General. She had one of the highest lead contents in her water in the city. She was going through rashes, and it was the strangest thing. I watched him as he looked at her hands. He's definitely a doctor, like really caring man. And he's caring for her. He's looking at her hands, and we go to each one of her faucets, and they all test differently. The water that looked like you shouldn't drink had the lowest lead content, and the clearest water had the highest lead content. So I just learned to listen to everybody and what's going on. I mean, right now we have blocks of people with the same cancers. We have situations where they say that abortions, sorry about that miscarriages are high. So it's being willing to listen to those stories and willing to sit not just as a reporter but as an individual who cares about people, like people before stories, because this is a really traumatic thing. And then also being able to ask questions that people won't ask, like they're addressing children but they're not necessarily addressing adults. And so I had to ask the doctor, well, how does this impact adults? Nobody's talking about it. And she's like, well, kidney failure, high blood pressure, gout. And I know some people who have said they've been diagnosed with these things, high blood pressure and gout, or the seniors. They're not drinking the water. So since they're not drinking the water, they're not getting fluoride. They're having dental issues. And I got that from BAAA, the Area Agency on Aging. So there's a lot going on in this community. I'm just one person. I'm trying to cover it. Hopefully I can get to some of these stories that I'm telling you all about. But it's one person asking the questions out there in the community. I have to be fierce. I have to not worry about burning bridges. I have to, if I go to a press conference, I might throw out a random question that has nothing to do with that press conference because I can't get the answers. If I send you an email, you might not tell me that adults are being impacted. But if I ask you in the middle of a press conference, I throw you off that quick and you might answer me. So I had to give that up. Like, I don't care. Elected officials, they come, they go. That's how I have to look at it, you know, but the community and the people in it, they're always there. So I guess my advice is listen, go below the surface, you know, ask the questions, don't be scared to burn bridges, build relationships in the community, troll social media, you know, I troll Facebook and I join every group. Any Flint water crisis group, any Flint group, and I found a woman who had a rare bacteria in her lungs that the doctors at Wayne State, they had told her she needed to wear a mask to going out of her home because of this bacteria that was typically only found in hospitals. When I called the health department, oh, we don't know what's going on there. The next day they dropped a press release about this rare bacteria she had been complaining about, but I was already on top of the story. So I already had talked to her, and then after talking to the health department, by the time they dropped the press release, I'm dropping the story. So, you know, I have to pay attention, a lot of attention, and not kick myself for not being able to get to all the stories. Like that's what really gets to me, is because I've sat in people's homes that dealt with like Legionnaires, and one young lady being in a coma and her mom watching over her, and she still had to push through. She's only 24 when she contracted Legionnaires. You know, now she's healing, but it's slow.
Wow.
You know, so it's a big deal to you.
Do you see an end in sight to this?
Well, I see an end in sight to maybe the infrastructure being replaced, the water being safe to drink one day, but the trauma to the community, I don't know. I don't know how long it takes to get over trauma when the government that you trust poison you, because this was a decision made by the state, you know, to cut costs. You know, with a group of people who, one in classism, they're poor. You know, it's a predominantly black community, but we have almost 40% white there too, which MSNBC, a reporter came there because of the high population of white people we have in Flint that are poor. You know, so how do you trust that again? Like, when is the day you wake up and you say, you know what, I'm gonna turn on this faucet and I'm gonna drink this water? I don't see it. You know, I've met people who have left the community and they won't trust it in the new communities they live in, let alone in the city of Flint. You know, that's the issue with the charter schools. Right now, the state is saying that the water is safe to drink. There's a recent report that said 98% of the homes in Flint have been tested safe, but only 4% of the homes have been tested. So it's 98% of 4%. You know, and so even as media, we have to be careful what we put out there. Like, we can't lead with that. You know, 98%, that's misleading. The water's still not safe.
So I was in the other room, I don't know if anyone was in the Google search stuff, but the guy was showing us this thing that I never realized you could do site searches for specific file types. Did people know this? So, for example, he said sometimes you might find stuff. So, let me see. So you can do site : and then the URL, like the domain name, .gov, and then it's file type. So, and let's do : see if there's any Excel spreadsheets that they don't want you to know about. Okay. So, but you could try that with like the local health department. I was like, so I'm sitting there doing North Carolina Department of Health and Human Services and doing file types, and I found the rate schedules for all of the providers. So I can compare what a doctor gets paid versus what a nurse practitioner, like just sitting in that thing. So there's some really powerful tools to find some of this stuff. So you had a question?
Yeah, well, first of all, I just have to applaud your efforts. I mean, the two of you are doing this amazing job with such limited resources on your own, and I'm just really impressed with all that. Just to comment there. And two things. One, I wondered if anybody knew about this website, Health News Review. Have you ever seen or heard or used
Oh,
that?
absolutely,
Yeah, they're great. Actually, I
Gary.
did medical news for CNN for many years, and the man who runs this is Gary Schweitzer, and he's my boss, so I can definitely tell you that he's like, it looks at anything that's made a claim of efficacy, and then it analyzes how well it did. Yeah, there you go.
But he's got a toolkit of how you can do
Yes.
a better job of analyzing health claims. So, whenever you see this stuff, it's like taking a look, it's just that numbers, absolute versus relative risk. Oh yeah, this had a 50% increase, but it was like, but the study, in one group, it was 3 out of 100 patients, and in the other, or 2 out of 100 patients, and in the other group, 3 out of 100 patients, right? So that's a 50% increase, but it was only one person out of every 100, right? So they go through explaining all this stuff. So if you go to healthnewsreview.org, and you'll find the toolkit, it's great stuff.
I wonder if you both can talk about what the reaction has been from your readers to your efforts, your websites, or I think you said newsletter. Yours is a newsletter?
No, I have a website and we do a newsletter.
And a newsletter.
So
You said you've been doing this for how many years?
My launch date was November 10th, 2011.
Okay. Versus
So-
you just started in March, so.
I get, since I live in Chapel Hill, there's lots of journalism students there, and they all say to me, wow, like, how do you do it? And I say, well, my advice for you is marry well. So 6 years in, I have yet to get paid. My husband's an engineer, we don't have kids, we live in a house that he bought as an estate sale. We're only $20,000 left on our mortgage. I just got rid of my 25-year-old car and got like a new, car last year. And all we have is a dog, right? So we don't have to, she broke her leg a couple of years ago, and I said to him, we don't have to send her to college, so so we don't have to worry about a lot of those expenses. So that's how I'm able to do it. My first year, our revenue was $8,000, and last year our revenue was $114,000. And I have to say, the first year you're like, you've got so much enthusiasm, and the second year was the year that I found to be the hardest, because you don't have that initial enthusiasm, but you're still slogging away, and you don't quite have the audience yet. But nowadays, I go around the state, and people know who we are. I have 3 people who work for me. I have 1 person who works full-time. She covers rural and mental health. I have 1 person who I buy about 15 hours a week of her time, and she does environmental health. So we do a lot of water quality. I think we've been kind of crushing it on this thing on Gen X, which is a chemical that was found that had been released into the Cape Fear River, which is up in Fayetteville, downstream to Wilmington. A couple 100,000 people's water has been affected. And we were the first people to break stories on something called trihalomethanes in water, and 1,4-dioxane. And that was because my reporter just did a bunch of digging. She's very experienced. Then I just picked up a guy, and this was like, make this, like, someone will give me donations, and still, my accountant who's on my board, he's like, Rose, we gotta get you paid. And I'm like, no, I don't want to get paid. What I want is some of my time back. So instead, when we get money, I hire other people to write so that I can now take Saturdays off, right? So, and so we've got somebody who just started writing about the business of healthcare. And I already told Dylan that next year I'm going to do a session here on how to cover your local hospitals, because now he's able to do this stuff, and it's something that they do at AHCJ. So
So far as reaction for me, are you speaking how people react to the site in general, or
Yes,
the coverage
your
more?
readers and people who are engaging with the site.
I don't advertise. I'm the new kid on the block, so most of my traffic comes from social media. On average, I get about 6,000 page views per month. So I think now I'm at about 60-something thousand page views, about maybe 1,200 unique visitors per month, which for me, I guess is good since my goal is only 4,000. I know that the community, they're watching. I get picked up locally from the other news stations and papers. I've been aggregated. I've been called to radio shows about stories that I've written. And also my Facebook community, they comment and they give me high fives and they expect me to do what I do. And when I don't, I have to hear about it. So that I do know.
But you said you have another job, so this is not your main gig then.
I have a day job. I'm a communications and marketing specialist for a drug recovery program. So, which is also a public health issue.
Yeah, I mean, people say to me, why are there why aren't there more health news websites around the country? And I said, I mean, I'm lucky. I acknowledge my husband's contribution every time I speak because, I would not have been able to do this without him. And he's an engineer and he's a computer science guy and he programs. And, every once in a while I'll say to him, like, is this okay? And he's like, look, you're doing important work. I'm just clearing the way for our robot overlords. So I'm really, really fortunate. But like I'm at the place now and, I also have a development person who's really made the difference for us. She's helped us get to the next level. We are like, that's our goal for this year is to get, at least like half-time pay for my position. Not so much to pay me, but to make sure. So I worked in 2014, I was diagnosed with cancer and I worked all the way through treatment. And I went down to maybe like 40 hours a week instead of 60 hours a week. And I told my board I'm not doing that again if I have a recurrence. So currently there's no recurrence, but like if they discover a metastatic tumor, I'm not gonna keep doing this, right? So we need to have a way to fund what I'm doing long term. So that's our goal now is to do succession planning, but I don't plan on going anywhere. But it takes time. It really takes time to get up and make it happen.
You guys don't get rest. I do my day job and then I do Flint Lead, then I do Flint Beat, then I do it again. And I don't rest on weekends.
I was thinking though, I hope like both of you, but you in particular, are like taking time for yourself because that sounds emotionally exhausting.
It is
It
emotionally
is, and
exhausting.
right now we're in the middle of a messy recall issue. We like 17 candidates running for mayor, 18 candidates running for council. I had to do 2 mayoral forums and print out a voter's guide. 30% of our community, they really don't do internet. And it's just, yeah, I'm a busy lady right now. I probably, like I said, I won't slow down until probably November 8th to get things in order and organized. I did pick up a young man, he's 18, his name is Andrew Roth. He does some freelancing for me, but not local government, like the governor's race. He covers those candidates. He's doing this big women's conference for me right now while I'm here. And I pay him from the money that I make during my day job because I'm not making money from Flint Beat. It's work. I stepped out there. I didn't quite realize how much work it would be. I'm okay with that though. I feel like coming to places like this that I'm developing relationships and a network to help support me through this journey. I feel better about it. And like I said, it can be crazy stressful. I'm not just a journalist. I'm a part of that community. I grew up in the Flint area. So I get the phone calls. I get the emails. I get the inboxes, about any and everything from my puppy just fell in its hole to my whole body's broken out with rashes from the Flint water, so it's a bit much. But so far I'm still here. I'll probably only have 10 extra gray hair. And I've seen it. Yeah, you see it. I just feel like I could do better. And that's my thing. I feel like I'm just starting and I see where the community just needs a little bit more, maybe a lot bit more from me to get the news and that they deserve.
We gotta get you a grant.
I'm working on it. That's why I'm here.
All right, there you go. Well, we just got the high sign to wrap up, so thank you very much.
Thank you.